Dhanvantari Namaha. Shri Guru Namaha. Namaste and very warm welcome to webinar series on Ayurveda practice organized by Ayuryana. I am Dr. Meghina, pleased to be host for today's session. I heartily welcome to Dr. Radha Chaitanya, co-founder of Ayuryana, and our distinguished guest speaker, Dr. Rakesh Sharma KM, sir, and our all audience to today's session. Ayurveda is a platform offers a unique blend of health-focused educational activities and sustainable tourism. It's inspired by a timeless principle of Ayurveda, thread modern culture and traditional values into every experience, which creates a rich tapestry of heritage and wellness. Now, I would like to brief about our webinar. Webinar series on Ayurveda practice is a free webinar series, and its motto is to empower the Ayurveda fraternity to excel in clinical practice and sustainability through innovative approaches in Ayurveda entrepreneurship. Don't forget to like, share, and subscribe the channel. Today's topic is clinical importance of Yashtimadhu by our beloved Sir Dr. Rakesh Sharma KMs. Sir is from Honnali Taluk and Shimoga district. Completed his UG from JSS Ayurveda Medical College, Mysuru, and MD in Dravyaguna from JG Ayurveda Medical College, Gataprabha, Belgavi. Since 10 years, Sir is running his own hospital, Sri Tulsi Ayurvedalaya at Durgigudi, Shumaga. Sir is expertise in the management of Pakshagata, Gridrasi, and many types of Kushta and Pranas. I once again welcome you, sir, and the mic is yours.
Thank you. Namaste. Om Namo Bhagavate Vasudevaya Dhanvantraye Amritakalashahastaya Sarvamaya Vinashanaya Trailokyanataya Shri Mahavishnave Namaha. Bowing my head to the Lord Dhanvantari, I just thank Ayuryana team, whole team. So today's my topic is clinical importance of Yashtimadhu. So the Yashtimadhu, as you know very well, the Yashtimadhu is the Latin name is Glycyrrhizia glabra, and it's from Papilionaceae family, and it's called licorice root, and its main useful part is root. Many of the times we get in the market as an adult rent of Yashtimadhu as the kanda, that is stem bark we get, but exactly in the Samhitas they told to use the root is the main important part used in the Yashtimadhu plant. So, and coming into its these are the few basic information we will see, then we will enter into the clinical importance in a day-to-day practice. So the main useful part, the root, and its available place is Sindhu Desha, that comes in the Gujarat and Rajasthan area, and nowadays it has been cultivated in the Kashmir and Himachal Pradesh region, and the Yashtimadhu now it has been imported from the many of the other countries also nowadays. So coming into its rasa panchakas, it is its rasa panchakas like Madhura Rasa, and its guna is Guru and Snigdha Guna, it's Shita Virya and Madhura Vipaka, and its actions mainly on the Vata Pitta Shamaka, and even in the Rakta Dhatu, like Rakta Pradosha Vikaras also, it's one of the useful plant which we can use in a clinical practice day to day, and it's Kapha Vardaka. And coming into the dhatus, main actions on the dhatus, it mainly acts on the rasa, rakta, mamsa, because it has got the similar properties of mamsa, that is pichila and snigdha and madhura rasa, and it's also acts on shukra in the both the way, directly on the shukra, and also uttara dhatu poshana, that is rasa, rakta, mamsa. Similarly, it does the nourishment to the shukra dhatu also, and because of these actions, it also nourishes the ojas, and to get the good quality ojas, so this Yashtimadhu has a main role. Okay, so these are the few basic important features of Yashtimadhu we should know before practicing. So in a clinic, in a samhitas, if we see, they say that Yashtimadhu is na pradana aushadam, but it can be used in many conditions by mixing with the other medications. So, and at the same time, it has got the Bahuguna and Bahu Upayogatvat. So, when we do the Samyoga with other medicines, or if we use a single medicine, single form of Yashtimadhu, it has got the many qualities in the clinical practice, and which potentiates it acts as a catalyst, and it increases the quality of the other medicines also. And one more important thing is if we see in Charaka Samhita, in Ganas, so the highest repeated drug in Gana, because Charaka we considered as the Ganas has been made on the basis of Karmopayogi Ganas. Like based on the karma, the Ganas has been made. Means based on the karma means it's purely related to the clinical practices. Okay. So if we see in Charaka Samhita, it has been mentioned in the 11 Ganas. The highest repeated drug in Gana is Yashtimadhu. Okay, means we can think of that how broadly we can use broad spectrum usage of Yashtimadhu. Okay, the second one is Pippali, and third one is Haritaki, they have mentioned. But in a broader way, if we see why the Acharya Charaka has been given importance to the Yashtimadhu, means it has been mentioned in the 11 Ganas. You can see like Jivaniya, Sandhaniya, Varnya, Kantya, and Snehopaga, Astapanopaga, Daha Prashamana, then Mutra Virajaniya, then Angamarda Prashamana, and Shonita Stapana, and even Vayastapana. So, if we see why it has been mentioned in the each Ganas, so we can get the clinical importance, how broadly we can use the Yashtimadhu. So, my guru, my sir used to say always that when the patient comes, if we are not getting the Nidanas, or if we are not understanding the disease, if the complicated patient comes, if we are not understanding, or if we are not able to come into the conclusion that what are the nidanas and what is the exact diagnosis, so he just used to say us like you can give Yashtimadhu churna or Yashtimadhu drug for few days. For few days means 3 to 4 or 5 days. So within that you can get back to the disease and get the clarity with the diagnosis of the disease. Then when patient comes after 3 or 4 days, so at least minimum results we can see in the patients by giving the Yashtimadhu. So what it means? It means like Charaka Charya is also Apta, and even our gurus are considered as Aptas. Means even without knowing any disease, or the minimum basic knowledge, if we think of doshas and dhatus, and if we give the medications of Yashtimadhu Churna, will get the minimum result with the Yashtimadhu. That is the broad spectrum activity of the Yashtimadhu drug. We can use it in a clinical practices. So, and here also, if we see in the Charakokta Ganas, like it starts from the Jivaniya, Brahmaniya, Vedaniya, like that it starts. So, in the first Gana itself, because the Charakokta Ganas are more clinical, and it is very scientific even today also. So, to live long life, the Jivaniya Dravyas are very, very important. So, the Yashtimadhu has been mentioned in the Jivaniya, and it ends in the Vayastapana. The 50th Gana is Vayasthapanopaga Gana. So, from the starting Gana till the end, in the both the Ganas, the Yashtimadhu has been mentioned. So, if we use properly the Jivaniya Ganas, even the Vayas, that is Jara Vadis, can also be prevented. Means the Yashtimadhu can be used as both the preventive and curative aspect also. That is what I told, that is it can be used in a broader aspect also. So so coming into the clinical importance, as today's topic, we'll discuss not all the aspects of Yashtimadhu, whatever I am using in clinical practice, in a day-to-day practice, in a different aspect. Because Yashtimadhu, if we see from the basic to end, it will take long time, and it's mainly the clinical importance I'll share with you, and even still more information you can get it in the get about the Yashtimadhu. It's purely about my knowledge and my clinical practice with my whatever my gurus are taught, what I'm getting the results in the clinical practice I'll share with you. So Kasa means normally we get in the clinical practices many varieties of Kasa and Shwasa. So mainly that is Vata Pittaja Kasa or Kshayaja Kasa or even Pittaja Kasa, it can be used. And many a times we get the patients in the clinic that the patient comes with the Kasa without any sputum, like after coughing there is very less amount of the sputum, and there will be chest discomfort, and even after coughing, like the swarabheda or the harshness of the voice and all we get. And even with the by coughing there will be so much of burning sensation in the throat region, and by cough the patients will get the pain in the chest region and all. So this is purely related to the Vata Pittaja Kasa or Vataja Kasa. So in that conditions, directly we can prefer the first drug of choice will be the Yashtimadhu. Along with that, you can give with the permutation and combination with Sitopala or something like that, or your Yukti. But the main prime drug should be the Kasa, because it has got the Madhura Snigdha Guna. It acts on the both Vata and Pitta, and it is having Madhura Vipak also. And action is mainly on Vata Pittaja. And even in the allergic bronchitis, the patient will be having Kasa or the cough since from the longer duration, like 1 month or 2 months, and they come and say that I have taken antibiotics or even with the steroids or any other medications. By taking that medications also, the cough is not reducing. So that is purely the Vataja Kasa. So in that condition, especially in the allergic bronchitis and all, Yashtimadhu Churna or Yashtimadhu Kashaya will work very nicely. And even the as in the classics they told that in Kasa and Shwasa the dravya has to be given muhurmuhu. So Yashtimadhu root you can take and you can give it to the patient like every half an hour or 15 minutes once. He can chew the Yashtimadhu root and he can suck the rasa, so that will reduce the frequency or status of the Kasa will be reduced very fast. Like within 1 or 2 days the patients will come out from the Kasa. And when the patient will be having Swarakshaya, that is in the singers normally we see like from morning to evening if they sing, or in the teachers who are all teaching them, or if we talk very like in a functions and all so much of loudly if we speak, there will be prakop of vata. In that particular conditions also, if we give like 1 or 2 doses of Yashtimadhu, it will give immediate relief, because the patient typically they come and say that after shouting my voice has gone, and after shouting he starts getting the cough, and even for coughing for 5 minutes or 10 minutes, so the patient will not get any type of the sputum. So in that conditions also this can be Yashtimadhu can be used. And one more thing, in Samhitas they have told it is kapha vardaka, kapha karaka. So when the patient comes with the Kasa and Shwasa, the Purana or old Kasa and Shwasa, and they have used many of the medications, but still they are not getting the results. So they are facing difficulty in the uh, uh, remove the Kasa, or Kapha Vilayana or Kapha Chedana will not happen with the medications. So in that conditions also, and even if the patient says that in allergic bronchitis and all, because nowadays we are getting more cases of the post-COVID cases and all. If the cough comes, it will not go for minimum of 15 to 20 days. So in that conditions also, and along with that, if the patient strains so much with the cough, the patient will get the hematemesis, like blood mixed a little bit of sputum. So in that conditions also, so the Yashtimadhu Fanta or Yashtimadhu Hima or Yashtimadhu Kshirapaka can be used. And along with that, Yashtimadhu Grita. In these conditions, we should not use the honey as the adjuvant or anupana. So better to use with the Yashtimadhu Hima or Yashtimadhu. If it is Pittaja, Yashtimadhu Hima, or if it is Vata Lakshanas, if you are seeing more, Yashtimadhu Fanta you can use, and even Yashtimadhu Grita can be used, because Yashtimadhu has been told in the Rakta Pittagna also. Rakta Pittahara also it has been told. Okay. One more important thing is in the children's. In children's, normally we get the Kasa and Shwasa. So in that they are Sukumara. We cannot use so much of strong drugs also. And along with the Yashtimadhu, we can mix it with Sitopaladi Churna or any other dravyas. So we can use in the Yashtimadhu, and it gives very wonderful results also. Okay. The next one is the Sandhaniya karma. Sandhaniya, it is also very broad term, like in Vranaropana and in Kshina Vrana and Sadhya Vrana and Parikartika. These are the few conditions where we can use in a day-to-day practice. For Ranaropanartha, once if we treat with when the wound cases come, Sandhaniya means not to unite. Sandhaniya, the name itself, to unite or to rejoin. So it can be in Asti Sandhaniya or Rana Sandhaniya, or any of the deformed structures can be brought into the normal condition is considered as the Sandhaniya. That can be bones or muscles, or even in the conditions like neurological conditions also it can be included. So Vranaropana, once when the patient comes with the Vrana or even diabetic complications or any type of the Vranas, we treat in the early stages when the condition is in the Amavastha or in Pakvavastha. So once the pus has been completely drained or the doshas are being removed, so by using Jatyadi Taila or any Haridra or honey, any of the Pranahara Dravyas can be used. Once if it becomes Shuddha, like you get the healthy granulation tissues, like reddish granulation tissues, and the pain has been subsided little bit, and burning sensation will also be subsided, and the pus or whitish pus discharge will be reduced. In that particular conditions, so immediately we can use the Yashtimadhu Taila as a Vranaropana to improve the quality of the skin and to reduce the scar formation. So it helps for to fasten the healing property of the Vrana, and wound will be healed very well. And in Kshina Vrana, like we have treated, we have removed the slough or pus, but the wound is not coming up, like the muscles are not growing very fast, and the wound is not joining very fast in the many of the bigger wounds and all. So in that conditions also you can use Yashtimadhu, Yashtimadhu Taila, and even with the Churna, Yashtimadhu Churna we can mix and we can apply, that is Bimlapana Karma. So mix and we can apply in the wound area, so that will help to grow the skin, because we have seen in the mainly in the Mamsa Dhatu also it works very well, because in the Mamsa Dhatu Yashti Mamsam Vardayati Brahmayati Cha means Yashtimadhu, which helps in the Mamsa Vardhana and Mamsa Brahmana Karma also, it works very well. And in the Sadhyavrana Chikitsa, like any acute injuries, acute Vrana, so Yashtimadhu Taila Sechana has been told in Sushruta Samhita. So Yashtimadhu Taila apply, or even with the Yashtimadhu Taila Dhara we can use, because it acts on the Rakta Stambana also. Whenever there is an bleeding is there, it helps to stop the bleeding, and at the same time it helps to heal up the wound, so it prevents from the formation of the pus also. Okay, so and one more conditions we get in the clinical practices, what we have seen with my guru, like in the conditions of neurological deformities, progressive neurological disorders like multiple sclerosis, or any myelin sheet related issues, or any like Parkinsonism diseases and all, progressive neurological deformity disorders, in that particular conditions also we can use as a Yashtimadhu uh, uh, internally also, and at the same time it can be used as the basti, like we have seen Astapanopaga Dravya as Yashtimadhu. So Sandhaniya means wherever the neurological disconnection is there, it helps to unite the nerves also. So that gives the Jivana karma to the cells. Even in the deeper level, we can use the Yashtimadhu as Sandhaniya Dravya. And even in the burn wounds also, we can use Yashtimadhu. And in the conditions like management of Parikartika, like acute fissure in like whenever the bleeding is there and the patient comes with the severe pain, along with that the burning sensation and bleeding per rectum, in that particular conditions also you can use as internally Yashtimadhu Amalaki Avipatikara Churna internally, and at the same time Yashtimadhu Taila mixed with the Jatyadi Taila, or even if you think that Pitta Pradhana is there, then directly you can use Yashtimadhu Taila. Along with that, Navanita, you can use as a Matra Basti for 1 week or 2 weeks until the patient gets relieved with the pain and bleeding per rectum. So continuously you can use. In our clinic, we suggest the patient to take for until he gets relief from the burning sensation and pain. Normally it will come down like within 15 days or 10 days, depends upon the condition. And the one more benefit of this Yashtimadhu Taila with Navanita or Yashtimadhu Taila plain Matra Basti is it reduces the pain and it stops the bleeding, and it also helps for the healing of the wound. So it gets just relax the sphincters, and it helps for the healing of the wound in the fissure conditions also. So the next is Varnya. It has been told very good Varnya Dravyas. We all know that Yashtimadhu, Sariva, Manjishta, Vacha, Lodra, these are the few Varnya Dravyas has been explained. In that, the Yashtimadhu is one of the best drug in Varnya. Most commonly, we get it in the like conditions of Venga, like during menopause time or after delivery. In the females, normally we get the blackish pigmentation over the face, that is butterfly diseases and all. So when the when the skin is very thick, when there is a blackish discoloration is there, so you can use Yashtimadhu and Sariva as a scrub. You can mix the powder together, and you can add little bit of water, and you can apply over the face. Then after washing that lepa, you can use directly with the Yashtimadhu Taila for the local application, and we can leave it for the whole overnight also. So if it is like the patient will be having so much of dry skin, you can add Anupana as Kshira, or Kshira and Yashtimadhu Lepa, or Yashtimadhu alone you can use, or Yashtimadhu, Lodra, then Sariva together mix and prepare the lepa, and it can be given for the application also. If the patient will be having oily skin, we can apply only with the water. If the patient is having dry skin, we can add little bit of Kshira and mix it as the lepa, and it can be applied. And one more classical reference we get in the Vaishya Ratnavali about Yashtimadhu, that is Kanaka Kanti Taila. So in that, the main ingredient is Yashtimadhu is one of the ingredient, and it's very easy for the preparation also, because in all the dravyas are Varnya, that is Manjishta is also there, Priyangu is there. Like that ingredients will come and it gives very wonderful result in the Venga. But in that, the main key ingredient is the Yashtimadhu is the drug main. Yeah. So next karma is Kantya. As we discussed previously, Kantya, there are two types of, you can, for the clinical practices, we can divide. Kanta is the sthana for kapha mainly. When the patient cough, even the one of the main drug in Kantasthita kapha is Kantakari also. So when the patient comes with the Swarabheda with Vata Pittaja type, like because of the Sangeeta Patana, or because of the teaching, or because of the shouting, or any injury, and even many of the clinical conditions I have seen in my clinic is like once the patient uses the in the rheumatoid conditions, if the over usage of the steroid or painkiller, so that increases the Vidahi guna in the body, and if it affects on the vocal cord, because of that also the patient gets the Swarabheda or Swarakshaya. So that they consider as vocal cord palsy. In that conditions also, many of the cases in my clinical practice I have seen. So Yashtimadhu, chewing Yashtimadhu, the root itself, and even with Yashtimadhu tablet, Yashtimadhu Ghanavati or Yashtimadhu Fanta, we can use it for the longer duration, because even in the Pravruddha Amavata or Purana Vata Rakta, in our science also they have told as Rasayana. So Yashtimadhu is considered one of the best Rasayana Dravya and Vata Pitta Shamaka, and it mainly acts on the Rakta Dhatu also. So in that type of complications also, the Yashtimadhu gives wonderful result. When the kapha is the main predominant thing, then we can go with the Kantakari as the drug. Kantasthita kapha, to remove the Kantasthita kapha, because of that any Swarabheda is there, then the drug of choice will be the Kantakari or Vyagri can be used. But mainly, if we see Nidhana, our treatment should be Hetu Viparita Chikitsa, Hetu Linga Aushadha Gnana. Like we should analyze for every patient blindly, we cannot give the single drug. Based on the Hetu and Lakshanas, we can go with the medications. Based on that, here it has been told Kantya. And even many of the patients will come that, so they will be having the continuous programs, and they will be practicing hours together, singing competitions and all. In that, the Yashtimadhu, in that condition, Yashtimadhu can be given for the longer duration, because it starts from the Jivaniya and it ends with the Vaistapana. So, and even in Kanta it has been told. So it acts as the curative and preventive, and at the same time it acts as the Rasayana also. In that way, it can be used for the longer duration also. So one more concept has been told, the Yashtimadhu. It is in one more gana, Daha Prashamana. Daha means it can be Urodaha, or it can be Mamsagata or Raktagata or Rasagata or Amashya Antargata. Daha also, the Yashtimadhu can be used. When the patient comes with the chronic gastritis or chronic constipation, because of that, the patient will be having the burning sensation in the throat region, or burning sensation in the chest region, or abdomen burning sensation. That is Amashagata, Antardaha. And even to some patients will be having the habit that if they get the burning sensation more, if they get the gastric symptoms, they start using their fingers and they continuously do the vomiting. uh, it becomes the habit. Because of that also, when the regurgitations comes, the patient will be having the vomitus mixed with the blood. In that conditions, the patient will get the burning sensation in the throat region and all. In that conditions, the Yashtimadhu is one of the best drug of choice. Many of the conditions, like in the gastritis and all, after COVID, the patient themselves use the medications without any knowledge. They use many of the medications in the medical shop directly, and they are habituated to use the gastric medicines. So, but one stage, even that medicines will not help for them. In that particular conditions, the chronic gastritis and all, the Yashtimadhu will works in very broader aspect. So it helps to reduce the regurgitation, and it helps to reduce the burning sensation. It acts as the rakta pitta hara also, and even it improves the digestion also. In and it is also told in the Chardi Nigrahana, if we use in the minimum quantity, it acts on the to preventing the woman also. So Eshtimadu alone you can use, or along with the like Amalaki Churna or Avipatikara Churna, any with the combinations also you can use based on the uh, Pradhana dosha, Amshamsha Kalpana, you can use with the Anupana, either Kshira or Eshtimadu Kshira, either with the Eshtimadu mixed with the Grita, or you can use with the Hima directly, or Kashaya also you can use directly. So even if the gastritis, if it is not responding with any of the medications, if we use Eshtimadu combinations, definitely we get very good result, and even the patient will get the uh, taste also. Many of the patients will be having the loss of taste and smell, and other conditions will also be help improved by using the Eshtimadu. And not only in the conditions of daha prashamana, means not only like antar daha, and in a day-to-day practice we get the conditions like post-herpetic neuralgia. Like the patient will suffer with the visarpa, that is sarpasuttu or herpes zoster. They use some local medications without their knowledge, or even if they get prevented with the herpes, but by that time the patient, or even if they use the antiviral ointment also, the peripheral neurons will be affected, and by that the patient will be having the burning sensation in the end part of the neurons. So in that particular conditions, again Eshtimadu Kshirapaka internally, along with that Eshtimadu Taila for local applications will give the wonderful result. That is in the management of the post herpetic neuralgia, like even after the relief from the visarpa, like symptomatically externally, but the patient will suffer with the burning sensation and all. So if you take the history nidana, we get that history in that particular conditions also. It works in the broader aspect, like it reduces the antargata rasa rakta and rasa rakta gata pitta, and it helps to um, uh, it acts as the rasayana also, and it helps to healing property also. So in broader aspect it helps, and even in the duodenal ulcers also it can be used. And one more conditions we get that in the clinical practice is, that is dhatu kshayajanya madhumeha. Like if we see in the broader aspect in the clinical practice, and even in the classics, stula pramehi and krisha pramehi, once if the patient uses for the medications, anti-diabetic medications for the longer durations, he starts getting the some of the complications of diabetes or madhumeha upadrava, what we can call padadaha and hastadaha, and burning sensation in the eyes and all. So in that particular conditions also, externally and at the same time internally also, Eshtimadu can be Eshtimadu Hima or Eshtimadu Fanta can also be used, because Madhura Rasa is having the Rasayana property, and it also help to improve the strength of the patients also. So in diabetic neuropathy also, Eshtimadu has got the broader aspect. Okay. Then Shonita Stapana, because of the Madhura Rasa, Shita Virya, and Vata Pitta Hara, for Rakta Stambhanartha, and in the Adhoga Rakta Pitta, like as we discussed already, the Parikartika, Arshas, and even in the conditions like the Pradhara Roga, that is Metroregia and Menorrhagia also, along with the Pushyanaga Churna or any other Nagakesara Churna, you can add Yashtimadhu Churna and it helps in the Rakta Pitta Prashamana. So excessive bleeding along with the Daha, to prevent that, the Yashtimadhu works very well. And the similar way, it acts as the Jivaniya also. Then Vajikarana, so Yashtimadhu Churna mixed with the Grita and Kshira can be used for the longer duration for Vajikaranartha. If the patient comes with the if we see hetus like Vata Pittaja or the premature ejaculations are in that particular conditions, especially if we see Pittaja Nidana, definitely we can use the Yashtimadhu Kshirapaka along with the mixing with the Grita, it can be used. And one more important aspect I have seen about Yashtimadhu is in my clinical practice, like by using many of the medications like steroids or any other painkillers for the longer duration, or any of the autoimmune disorders or any of the chronic disorders, or even by usage of the over usage of the system and mobile phones and all, the patient will get the dryness of the eyes and itching sensation and lack of sleep also. In that particular conditions, Yashtimadhu Kshira internally and at the same time Yashtimadhu Kshira Seka over the eyes will help to reduce the stress level in the eyes. So that is where it has explained as Chakshusha Rogas also, it has been told. So in overall, there are many clinical aspects we can think of Yashtimadhu. These are the very few clinical things what I have used in my clinical practice day to day. It's overall the very broad spectrum of the drug we can use in a clinical practice, and it's very cost effective also. So thank you one and all. I thank the Ayuryana team members for providing me the stage in the Ayuryana webinar series. Thank you, madam.
Sir, there are few doubts in the comment section, sir.
Yeah.
Okay, sir.
Yeah. Can we use drug in alopecia? So can we use the drug in alopecia? How to use, sir? It has been asked. So in the alopecia areata, like initially we have to go with the Krimihara Chikitsa, like Chitraka, then Khadira, and all other drugs. And local irritant drugs like Triphala Udvartana Churna can be used as the local irritant, and even many of the practitioners use Jayapala Bija as the irritant locally. Once if it artificial wound has been created, or then we can use Yashtimadhu Taila, one aspect. And another one is in a day-to-day practice as a rasayana, even in the Khalitya, I use Yashtimadhu single drug in the alopecia areata. So in that aspect, as a rasayana karma, to grow the hair, once if we treat the hetu, and to increase the volume of the hairs, we can use Yashtimadhu. What about chronic or long-term Kshayaja Kasa? Definitely. So that is what we discussed in the discussions. So long-term Kasa, Kshayaja Kasa, definitely if you see the Nidanas, definitely we can use the Yashtimadhu as Grita or Yashtimadhu. Kshira Kashaya can be used. Along with that, you can add, if it is so much of chronic, you can add little bit of Abhraka Basma. It also has very good Rasayana. Along with that, you can add Sitopaladi Churna. You can make your own combination as per the patient requirement. Definitely, it can be used and it gives very good result also. Yeah, definitely we can use in the leukorrhea based on the conditions. If the hetus, if you see, if it is kshayaja or if it is vataja, definitely Yashtimadhu can be used, because Yashtimadhu kshira acts as a very good rasayana. It works very well. Can we use the same drug in leukorrhea? The prolonged use of Yashtimadhu affects on male hormones. As such, we have not noticed with the Yashtimadhu like side effects. It doesn't. I don't think that Yashtimadhu will affect on the male hormones as the long usage, because it has been told as a rasayana, means you can use the longer time, longer duration. Even in the healthy persons also it can be used, like Amrita, Amalaki. Similarly, the Yashtimadhu, and it has got the Medhya Rasayana also. It does not cause any such type of effects, side effects. Can you explain more about the use of Yashtimadhu? Yeah, can you explain more about the use of Yashtimadhu in Anuvasana and Niruhabasti? As we have seen one patient in my clinical practice, I have seen more than 3 to 4 cases, and in my sir clinic, I have seen like around 10 cases regarding the usage of Yashtimadhu as Anuvasana and Niruhabasti. One of the main condition was the multiple sclerosis, the progressive neurological disorder. So, in that conditions, the Yashtimadhu initially, if you see any doshas like Vata Pradhana or Kapha Pradhana, to remove that avarana, you can select any of the bastis like Erendamuladi Kashaya Basti or Dashamula Erendamula Kashaya Basti. Then after that, you can take the plain Yashtimadhu Kashaya as Kashaya Dravya, and in Kalka Dravya, you can use Yashtimadhu Kalka, and you can prepare the Niruhabasti and you can give it. And even with the Matra Basti also, you can give Yashtimadhu Kshira Paka. Along with that, Grita you can mix and you can use it. It can be used for the longer duration. Normally, in the chronic joint disorders, if the Pitta is also associated, and even the Kshayaja, the Asti Dhatu Kshayaja conditions also, normally Dashamula, Ashwagandha, Gokshura, and along with that Yashtimadhu we can take and we can mix it with the Kshira Paka. We can prepare Kshira. Then you can add little bit of any of the Panchatiktaka or Gugulutiktaka Gruta, and you can give to the patient as Matravasti on the daily basis also.
Thank you so much, sir, for clearing all doubts.
Yeah. Thank you.
Thank you so much for the wonderful session, sir. Your insights shared were very impressive and motivating to all the younger generation of Ayurveda physicians.
Thank you.
Thank you so much, sir.